That means it is time for Wellness Wednesday. And we go to the phone right now and joined by Scott Campsall from Okami. Good morning, sir.
Morning, Dan. How are you?
I'm doing well. And also Jodi Bussiere from Uxbridge Physiotherapy joining us this week. Good morning, Jodi.
Good morning. Good morning, guys.
So we're all in our, isolation booths. For me, it's the radio station, the studio. For you guys, it is home, which is the new norm. And we were just talking about the fact that it is a new norm for both Scott, who started doing some classes online a number of weeks ago, and Jodi as well. You're now going and doing teleconferencing or tele-rehab, I guess you could call it. And a quick question right off the top. Physiotherapists were deemed as essential services. Why the decision to do tele-rehab rather than open up your offices?
Well, the first thing to realize is that we are essential and we do work in hospitals and with inpatients. And we have services we do for patients to help them cardiorespiratory-wise. But our college has made it very, very clear to us that it's only patients that are in emergency situations that we're allowed to treat. So when we're treating patients in the clinic, it's really only the patients that we are keeping out of the hospital beds that we should be treating in the clinic. So we're offering the phone and video conferencing appointments.
Okay, so
at the moment.
And I mean the protocol, and it's similar to what dentists are doing right now. There are very few; those that are open are only open for emergency cases. And what would that be deemed? I know with dentists, it's quite a substantial list of what is deemed to be an emergency. Is it a similar situation with a physiotherapist?
Well, yeah, if somebody had just had surgery and they weren't able to walk and they were at risk of falling and potentially having to go back into the hospital, that might be something that we would have to see them in person. But to be honest with you, we haven't been able to find very many reasons to be able to see people and risk the safety and health of the patient as well as risk the safety and health of our staff in order to open up the doors. And anyone who knows our clinic knows that, we've got 5 therapists working there at the same time and we have a busy waiting room. And so we just decided for the time being to keep the doors closed, and the telerehabilitation is really picking up. People are finding that it's great to be in the safety and privacy of their own home, and they get some really good service from us. Of course, we can't put our hands on you, but there is a lot that we can do in terms of education and telling you self-treatment techniques and showing you exercises. So it's working well for now. It's kind of the new norm, like you talked about. We have to figure out how we're going to do things until it's safe to open up our doors again.
Yeah, I was going to ask you about the mental aspect of it. Sorry, Scott, just about the mental aspect of it, because you mentioned that they're at home. Do you find that in some ways it's even better because mentally they may be a little more relaxed than they would be in an office situation?
You know what? I do find that people are very conversational and relaxed at home. It's interesting. They have to move the camera around so they can see their standing position or their sitting position or their movement. I even had one kid, he was in his home gym in the basement. So his mom turned the camera towards his home gym and we were kind of doing exercises together. So it's interesting what you can do on video. But we have a very private clinic area, so we've got private rooms, and I think people feel comfortable at our clinic as well in privacy. So we're making it work.
Scott, did you have a question there?
Yeah, so just what are you finding as far as techniques or tricks, or if you've even got any challenges? Like I know when we do our classes and you're trying to figure out even like move your left foot or move your right foot, or I turn a certain way so that I'm sort of facing the same way as a student, but it's sort of hard to figure out from a two-dimensional image, so to speak. Sometimes the movements get confusing or whatever. Like I've had an adult student even that, like for me, my first karate instructor would say, okay, go watch this video of this person doing this form or something like that, try to pick up information from there. And so I just sort of picked up tricks where you go, okay, they've got a logo on their jacket, and that's their left side. So I know, like, if I watch their left arm, it's like, okay, that works for me. But is there anything that you've noticed that, you had to change the way you give instructions or?
So this is a question to me, Scott, right?
Yeah.
Okay. I think because this is what we do in our career. We are essentially teachers in a way. We're teaching patients about their bodies. We're teaching them about their anatomy. We're teaching them about their exercises, what position that they need to be in. And we have a little more time than you. You're sometimes in your classes, you're on a time, a beat, like you have to keep the moves going to a beat. So it's a little more rushed. With us, if a patient doesn't understand something, then we take a little more time and we go over it with them, or sometimes an exercise doesn't work. And so then we have to find a new version of something for them. So we're constantly doing this at more of a relaxed pace. The first thing I will do with a patient the next time they come and see me is I will say, how are you doing? How did the exercises go? Please show me what you've been doing. And, they'll show me something and I'll say, oh, well, that didn't really go exactly the way that I showed you. So then I'll review it with them. So I think to answer your question directly, we're always using very, very specific instructions with them as to their body position and their angles and what they should be doing. So I feel like we're used to it, but I hear what you're saying. It's everyone, even teachers. I've spoken to teachers about what they're doing online, and it's a completely new way of thinking, and it's taking time for everybody to adjust, for sure.
You almost have to go back to the theater. Stage left, stage right.
Yeah. Yeah.
It does, and it really does make sense when you start doing some of the video. Now, I talked about people being more comfortable and maybe less anxious because they are in their homes. But let me flip that question around. And because of what is happening with COVID, and so many people are isolated, and socially we're isolated, do you find that people may be more tense with their muscles because of the situation they're going through?
That is a good question. I have not put my hands on a patient in about 6 weeks, so I wouldn't know physically.
Well, does that change the way you do things then? Because you're not physically putting your hands on, so you're not necessarily feeling the tension that may be there?
Sorry, can you repeat the question? Sorry.
Well, so, because you're doing it teleconferencing now as opposed to actually having hands-on, and you're going, oh, wait a minute, they really are tense and you got to loosen up. Through teleconferencing, can you still feel or pick that up, that they may be too tense in doing an exercise and you got to loosen them up a bit more?
Well, that's really a good question, because then you must think, well, how am I doing an assessment if I can't put my hands on patients? There's so many things we can look at. I look at, first of all, the history. So I ask them questions about how are you feeling, where's the pain, where's the tightness, that kind of thing. I mean, this is how we start all our assessments. Then I look at their posture. I ask them to sit. I ask them to stand. I ask them to turn around. I can see all these things on a camera. Then I ask them to do active movement. I can see a ton with the way they're moving. If their scapula is not moving properly, or if they're doing a squat and their alignment's off, I can see a ton of stuff. And then I even had a mom that had a little bit of knowledge on how to test strength. So I had her test her son's strength. I had her put her hands on her son's shoulder and tell me what she was feeling. I can look at range of motion. I can look at tightness. And then the patient will say to me, okay, when I turn my head to the left, ow, that's tight right there. So again, after doing this for a long time, and I don't want to say how many years ago I graduated, but I have a lot of experience with assessing somebody's reaction and where it's coming from and why. Then I will deduce that they do have muscle tightness, that they do have muscle weakness, that they do have instability. So it's amazing. It's just seeing how I'm able to carry out what I do in a different way. I thought it would be more difficult than it is. It's turning out that I can help a lot of people, and all my therapists are doing it as well. So it's great that we can provide this service.
You do sound surprised by it, and I'm wondering, as we move forward and when we get back to whatever is going to be the new norm and the office reopens, does this open doors for you in being able to treat maybe more patients?
That is a great question, and you're absolutely right. We did have patients before, particularly those that live far away from the clinic or patients that had just had car accidents. And they might have been in a wheelchair or not able to get to the clinic, and they would call us and say, my insurance will pay for you to come and see me. Can you come and drive out an hour to see me? And to be honest with you, it's just not feasible for us to be able to drive an hour, because that would be an hour of travel time there, the hour visit, the hour back, and that's 3 hours for one visit. We just can't be doing a lot of that kind of thing. We've done the odd home visit, but yes, this is great because now we have a platform, we have a protocol, we have all our forms, we have our systems in place. So we can start doing this for some of those patients that perhaps can't come to us in person for a little while, or maybe permanently. There's actually a lot of remote communities in northern Canada that they don't have physio clinics that patients can go to. So this is all they do is telerehab. So yeah, it's actually great that we have this a service now, and we might use it a little bit in the future.
Yeah, we found the same thing. I actually talked to a mom yesterday. She was hoping that we could still do these Zooms when we go back.
You know what, Scott? So, Dan, I am in my exercise clothes right now, and after I hang out from you guys, I'm doing one of Okami Kai's exercise classes. I've actually loved doing them. I'm doing some virtual yoga classes, and I love the flexibility of being able to just log on in the morning or at night and be in my own home. I mean, I love the gym, love going to the gym, but I think that all industries are finding that they're opening up different ways of doing things that is helpful for business.
Yeah, no,
we're definitely going to keep the in person because I just, to me it's so vital to have that social connection.
I
and
miss
even
the gym too. Yeah,
even just to pick up a body language or something like talking to other students, I'm saying like every little laugh or smile or movement or something gives you feedback, and when you're online as the teacher, you don't get that. Like I taught a class the other night, and Jennifer goes to me, she says, "Oh, that was a great class." I'm like, how would you know? Like it's just because like she thought it was a good class, and I said, but as far as the overall, like because you just don't get the feedback until afterwards, and then you've got students that are thanking you, and or you like you grab the odd smile. But that's one thing I like about what you're saying about your physio is like you got so much more one-on-one. It's I'm a little envious. Like we started doing some small private classes just because I like the feedback, I like the interaction with the students.
Yeah, it does make a difference. Now, back to not tele-rehab, but just teleconferencing. I know, Jodi, that on Friday you're going to be talking about shoulder injuries, and you talked about yoga. I guess it's the same yoga class, and in conjunction with them, you'll be talking about shoulder injuries?
So, yeah, it's actually through Pathways to Peace Yoga, which is a studio by the Testa building there, and it's Susan Ward who owns it, and she's doing a 12 Months to Health speaker series. So she's been doing this for quite a while, and she had me agree to do a talk last fall, actually, and it's this Friday night at 7:30, so it's Friday, April 24th. She's carrying it out via Zoom, so the topic is physiotherapy of common shoulder injuries, so it's a webinar that people can sign up for. And yeah, I completely forgot about it until last week because so much has been going on. Shoulder is a topic very close to my heart. I've had 2 shoulder surgeries myself, and there's a ton of different things that can happen to people's shoulders. It's just like any area of the body. It's not a recipe. So it's all about posture. It's about muscle balance. It's about whether you're tight, whether you're loose, what exercises you need to be doing. So I will try to touch on all of that, and I'm excited to be able to talk to a group of whoever signs up. I know there's about half a dozen signed up already, and there's still room for people to register. So if anyone's interested, I believe they just go on to pathwaystopeaceyoga.com, or certainly you can Google the website, and I'm sure Susan has information on the website on how you can register, and we would love to have you.
Now, I would think that shoulder injuries are a lot more common than maybe some even think about it, because you think about how many people are playing sports, whether it's throwing a ball, playing hockey, whatever, and people end up dinging up their shoulders over time, whether when they're in their youth or older, and those are injuries that just linger.
It is very, very common. I always tell my patients, I don't know what it is between the age of 45 and 55, but our collagen does change, and everybody knows about the rotator cuff. So the rotator cuff are a bunch of tendons that are made of collagen, and that collagen is less elastic as we get older, and they're more prone to injury. So, they're degenerating as we age. We don't even know it, and then we could do something little like lift up something the wrong way, and it just it does something more permanent to our rotator cuff. So that's just one of the things that can happen. But wear and tear over time, and sports and posture, and there's lots of other things that influence the shoulder. So your cervical spine, your thoracic spine. So those are areas of your back that the movement in those areas influence your shoulder, and you need to have the right muscle balance, which is where our trainers and our exercise people like Scott and Jennifer can help us on the gym end. So yeah, I could talk for a while. So I'll spend the next couple of days trying to focus my thoughts on what I want to get across to people on Friday night.
Well, is that your usual plan of attack? Like if somebody comes to you and says they have a shoulder injury, is it usually doing different exercises to strengthen that, or is it usually the opposite, where they say, okay, back off on the low? It's
a combination of both. And again, there's not a recipe that fits for everybody. Sometimes I can give somebody quick advice in 5 minutes, but it really depends on the situation. Sometimes it's they're doing exercises that are too hard for them. They have to lower the weight. Sometimes they need to do more strength and stability exercises versus heavy weights. It really depends on the individual.
It's a great time to check in then on Friday. Jodi, thanks for joining us this morning.
Thanks, guys.
Yeah, no, thank you.
Happy video conferencing.
All right. Have a good day, everyone.
And we're not changing here. We're still just going to be radio because people say I've got a good face for radio. So we're staying with that. How's that?
That sounds good because I'm in my exercise mode right now, and it's not good.
I'm sure it's fine.
Personally, my hair's a mess, so I guess.
Well, listen, guys, thanks for phoning in again this morning.
Oh, thank you.
Okay, have a good day.
Take care, you too. Bye-bye.
Bye.
Wellness Wednesday, and that was Scott Campsall from Okami and Jodi Bussiere from Uxbridge Physiotherapy.